A pleasant good afternoon from Sinje in Grand Kema County, not too far from the county health center head office here in Sinje. And we'll be touring the newly acquired 10 acre of land by the Ministry of Health through the county health center here in Grand Kema County for the Sinje Comprehensive Health Facility due to its limited capacity for patients. So we'll be in an exclusive conversation with the CHO, the County Health Officer of Grand Kema County, of course, his Dr. Daniel Kofa. So we'll be in conversation with Dr. Daniel Kofa, of course, he's the CHO of Grand Kema County, to give us more details about this 10 acres of land acquired by the Ministry of Health through the county health team of Grand Kema County. So, Dr. Kofa, welcome to the media.
Thank you. So where you standing now is 10 acres of land that was acquired by the county through the generous gesture of the community, the Zodwa clan. So this 10 acres of land was acquired, and we have, it has been surveyed, we have a deed. So now, this particular site, the immediate plan for this site will be hosting a trauma unit. A trauma unit is where you have victim or accident will seek care. And you know that it's very strategic location.
Yeah, very, very strategic, not too far from the road.
The Mamagida Highway.
The concession company right here too.
Yes, you have the movement, the high flow of traffic. So we do not want accidents, but we want a situation where in the event you have case of accident, there's somewhere for care. So this is made possible again through the general gesture of the community, the influential people from the community, the Zoda clan, the community of Sinje donated this property to the county health team for a long-term investment.
No, it's kind of confusing. I've been thinking that this was acquired by the Ministry of Health. You guys bought it.
So now the community has turned it over to the Ministry of Health, free of charge.
Oh, so meaning the dwellers of this community. What's the name of the community again?
So it's Sinje town.
Okay.
Yeah, so the Zodwa clan had owned this property.
The Zodwa clan.
Yeah, so this part of Zodwa clan.
Somebody would say Sinje has a big hospital, or why you guys trying to transfer to this?
So now, the immediate intervention is the trauma unit, and that trauma unit is by the support of NUCA, collaborating with the Ministry of Health to have the trauma unit. And considering now the growth of the population, so we have to now start to plan. In the next 4-5 years, the Sinje facility may not be able to contain the number of patients. So now we have to start to plan.
What's the current population now in Sinje?
The catchment communities, Sinje has 33 catchment communities, and the population is about 10 to 12,000 persons. Yes.
So
now, because of the Sinje being a major health facility, they are one of the major referral facilities in the county.
Of course.
So it means all patients from the districts, Tewa, Popa, including Gaula, and some part of Commonwealth, they seek care, medical care at the Sinje Comprehensive Health Center. So
on a daily basis, how many reported cases do you have here?
In a week, we have maybe an average 2 cases of road traffic accident, and the severity will vary. Sometimes you're having a vehicle with occupants of 5 persons, and then even the issue with motorbikes. So part of the public health awareness, we also say that drive safe, working closely with the police to ensure that the traffic rules and regulations are adhered to reduce the case of accident. But notwithstanding, as healthcare providers, it's also imperative and important that those, that will fall victim of accident, injuries, they should be there, somewhere there to give them help. So with NUCA collaborating with the Ministry of Health.
Hey, you have to get more detail about that NUCA situation you're talking
Okay, so
about.
as part of their corporate social responsibility,
Whose corporate social responsibility? NUCA.
Yes, so they have partnered with the Ministry of Health and the Grand Cayman County Health Team. Firstly, they did a need assessment, what they said that were needed, and based on the increased load of, accident cases, so that was proposed to them. So the idea was bought and then also approved by the ministry.
What was proposed after they shall have done after they get done well with the need assessment? What did they realize that the people here in Cayman really needed, and what did they identify?
So there are trend of events.
Okay.
So injuries, life-threatening injuries from accident is a common occurrence. It's a common occurrence. So looking at it, it's a major highway. Okay. So every facility along a highway, major facility should have, the capacity to take care of trauma patients for instances of accident. So that was a very good proposal, and it was accepted readily by NUCA, and they are willing now to support
This to build this trauma
to build
unit.
the trauma unit. The funding has been secured. What we are concluding now is the design.
So,
Design was
can
done.
you just give how much in total is not being
No,
spent?
I cannot give you the cost. Yeah, but what I can tell you is it will be a modern infrastructure that will provide, first-hand life-saving intervention for trauma cases.
It'll be very modern.
Yeah, it will be a modern.
Is it an extension? Will it be an extension of the Sinje Comprehensive Health Center?
So because the vision has always been there that there's a need to expand the Sinje facility. So this would be the birth of the Sinje Hospital.
Okay.
Or the Gala, yeah. So we have the trauma unit. In the future, there also be additional infrastructure that will host, other services.
Okay.
And in the next 5 years, we can be, crammed up in a small building.
Is this
so
land going beyond?
There's 10 acres of land.
Yeah, just take a walk.
Yes. By taking a walk, it will be, so I can point to you. So up to that point where you see those trees, the land extends beyond that.
Wow.
Yeah, it extends beyond that.
Wow.
Yeah.
Very, very big area.
Yeah. So this facility, this land space should host the hospital, should host staffing quarter, should host the maternal waiting home, and different other departments that can further expand, along the time.
Okay, lastly,
as
before taking leave of you.
Yeah, so again, we are happy. Development in the health sector will come gradually. It's about being, having a vision and then strategically doing the implementation. So again, that the community, the fact that the community is also willing to listen to us and lend their support is a very, very good initiative. So again, kudos to the community that have willingly donated this land, this property to the county, to the Ministry of Health.
Willingly.
Yes. And then
a dam wasn't paid.
Yes, free of charge. And then it is now, our duty to ensure that. I must also commend the Minister of Health, who has been on his site. She's seen it, and we have had a conversation about it. So it is with time, with planning, mobilization of resources, it can be achieved. The Senator Daba Fabula,
Chair on Health.
the Senate Committee Chair on Health. In fact, during the entire process of negotiation of the community, she was in the know, and her voice, adding her voice, to talk with the community to also give us this, made it easier. The representative for the district, Honorable Dozy, was also instrumental. The town chief,
Collaborative Legislative
the
Caucus.
elders, the dean elders, the town chief, even the youth. So it has been a joint, effort, and it is with time that we have this vision realized.
Okay.
Trauma unit, and to also
Just the accident hospital.
The accident hospital.
Yeah, come on, whether people get to know, say.
Have expanded and very spacious Sinje Hospital.
Very good in the nearest future to come. Folks, you listen there to Dr. Daniel Kofa. He's the County Health Officer of Grand Cayman County, giving us detail about the the trauma unit, I would just say the accident hospital that is about to be built here in partnership with the National Oil Company of Liberia, local, as part of her social corporate responsibility. In partnership with the Ministry of Health, the CHO has announced that 10 acres of land was donated by community dwellers in the Sinje town, as well district. I don't know what again I need correct, but it's a traditional name. And of course, in the nearest future, resources are now being gathered to start the commencement of this project. A very spacious place here, the Sinje Hospital, a comprehensive health center rather, is not too far from where I do stand, but it's not spacious enough to continue. The population now, you know, will have a growing population every night and day. People are born, and then the population is increasing on a daily basis. So as it needed through a assessment tour, be done by local. So this is what was identified by them, an accident hospital to be built not too far from the road. I do think it is actually necessary by them. So folks, thanks for following. This is DNS Liberia, and as part of the Native Men County Store, Health County Tour, Yoko Biade. So this is what we are. Thanks for following. So listen to Yoko.
Okay, good. I told you, I say, this government, and that baby government, when we talk about government, you see the young guys there, everywhere we went bon country, they forget the sea project. When they used to pass here, do the assess here, to their pass and go to Beer Martin and get what they want to get. And Beer Martin too, I think what the government need to do now, they need to close Beer Martin down. Because there's no development they carry on in this country. And this country needs development. They get people that from Beer Martin here, they get more. But the country is in darkness. That this government trying now to put things in order.
Okay, Yoko, you have more to talk about, so thank you.
I don't want to talk too much.
Okay, Yoko. So, you listen to Yoko. This is his health tour. The county health tour here in Kema County. And after that, we'll be going to 2 other counties. Thanks for following. I'm Urias, Fifth Yimpam, DNS Liberia. Baba for now from the Sinje town in Grand Kema County.